Hi, everyone. I'm Casey Seiler, the editor of the Times-Union. Thanks very much for joining us for this discussion on the phenomenon of vaccine hesitancy in the context of communities of color. We have an outstanding panel and a lot to get through. Our point for the evening is to discuss the phenomenon of vaccine hesitancy and explain some of the historical context behind it, to look at the vaccines that are now available across New York and across the country, and talk about their safety and efficacy, and talk about this problem and how overcoming it is going to be necessary to close some of the health disparities that have been pointed up by the coronavirus pandemic. And with that, I would like to introduce our panel. First, we have Albany County Legislator Carolyn McLaughlin, a longtime leader in Albany's South End. Dr. Lina M. Finlan, an emergency medicine technician at St. Peter's Hospital. Stacy Pettigrew, an assistant professor in the Population Health Sciences Department at Albany College of Pharmacy and Health Sciences, and a co-founder and executive director of the Radix Ecological Sustainability Center. Dr. Eric Yeager, an associate professor of microbiology in the Department of Basic and Clinical Sciences and a member of the Center for Biopharmaceutical Education and Training at the Albany College of Pharmacy and Health Sciences. Wilma Alvarado-Little, Associate Commissioner of the New York State Department of Health and the Director of its Office of Minority Health and Health Disparities Prevention, and Dr. Angela Antonikowski, Albany Medical Center's inaugural Chief Health Equity, Diversity, and Inclusion Officer and Associate Dean of Well-Being at Albany Medical College. Thank you very much all for being here with us. And to start up, I really wanted to turn to Carolyn McLaughlin to talk a little bit about her understanding of vaccine hesitancy, how it plays out on the ground in Albany, and if you could, perhaps some of the reasons behind it. You know, Bethany Bump had a story that appeared in print in Sunday's Times-Union and is online right now that, of course, goes back to things like the Tuskegee experiment and other examples of situations in which people of color across this country have ample reason to be concerned about government medicine.
Well, you know, as I have talked about this and have thought about this, it was like vaccine or no vaccine. That's the question. And even as I speak to individuals in groups or as just one-on-one, the overriding theme seems to be they just don't trust the vaccine. And not just the vaccine, they don't trust the government. And the first thing that people bring up is the Tuskegee experiment. And then of late, I've heard people speak of Henrietta Lacks, who her cells were, and they're still being used. This was like 60 years after her death. Her cells are still being used to experiment and do research. Some research that has been very good, but nonetheless, her cells were harvested without her permission. So it's those kinds of things that people are bringing up as they talk about their hesitancy to be vaccinated. While the average, I think, in the country is like 62 to 65% people say they will take the vaccine. In the African-American community, that hovers around 42%. And I think the Latinx community, it's you know, a little higher even. Look higher than the 42%. And I think Wilma will be able to speak to that. The Asian community has a high rate of willingness to take, they're like the 80% of taking the vaccine. And the African-American community is about half of that. And why is that? I mean, people are talking about the side effects. They think they're going to become sterile. They believe that they're going to get sick immediately. They believe that the vaccine contains COVID-19 and they will be experimented upon. They believe that the vaccine was developed too quickly, not understanding that there was research in place years ago to deal with this, and it just got speeded up. So it wasn't like a let's hit the ground and let's get this out that quickly. And they just think it's too new and they want to wait and see. Well, I'll wait till like 10 million people have gotten it. And then maybe I'll get it and see what, and then just politics in general. They believe that played a role in it getting out so fast. So just some very basic things that you have to give credence to when you talk to people, because the Tuskegee experiment was a government-sponsored study that people were told to put their trust in. And, you know, it was an institutional initiative. And that's how people look at the vaccine. It's a government initiative. And if you don't trust the government, how are you going to trust them to give you a vaccine that is actually going to make you healthy instead of making your life miserable? But also looking at the health disparities that were identified when the pandemic was declared. Why are you so concerned about me now when you weren't concerned about me prior to the pandemic? These are the kinds of things that I'm hearing from people. And how do you respond to that? When you look at the numbers of people that look like me that have been affected, it all plays. You really have to work hard to, and I don't work hard to convince. I work hard to educate people about why they should consider taking the vaccine. And but there's so much that we have to overcome because of, and I'll give you this personal example. I personally have already had the first phase of the vaccine because I do believe that I believe in it and it is important and I believe it's going to help me. I also have another family member who has taken the vaccine, has come down with the COVID, but we believe the case would have been much more severe had he not had the vaccine because he has some underlying issues. He's over 70, and yet he showed no symptoms other than fatigue. And we were discussing it the other day, and he believes that it's because he had the vaccine, the first phase of the vaccine, even though I know it's not at the 90% efficacy with the first phase, but we believe it had some positive impact on his condition.
We hear so much about fake news and knowing how paranoia can grow online. Knowing that this is sort of a pre-existing problem in society, especially among communities of color, and I would throw this out to Wilma or anyone else on the panel: is this problem growing worse, because of the digital wonderland where misinformation can spread so readily?
Hi, Casey. I think like Carolyn aptly said, it's the misinformation is in some cases more infectious than the virus. It's easy to find a post. There's people putting up fake TikTok videos of side effects of the vaccine, and it looks believable. So it really is a challenge. And I think it was one of the panelists said earlier, it's finding a trusted person, someone that you will listen to, that's giving you the straight truth about the vaccine. Like Carolyn said, given the vaccine, it's protected her friend, her family member from the disease. And, we'll talk about, yes, you'll feel some side effects of the vaccine, but the effects of the vaccine are far less than getting the disease, which we know to be deadly, particularly for communities of color.
Would anybody else like to add to that? Oh, Wilma, I think you're on mute.
I'm sorry, after how many Zoom meetings, I still get the mute, unmute, double mute, double unmute. And so, no, I completely agree. We had been talking a little bit about this, about who are the trusted members in the community. And, when at the New York State Department of Health, there's 3 pillars that are discussed. That vaccine is, at the end of the day, it's safe, it's effective, and the distribution of the vaccine is going to be equitable. And so, we're doing everything we can to ensure that our communities have whatever information we have. The governor has been very forthcoming with all the information that he has. He has based everything on data, facts, and science. And so it is now our role to take that message and continue to move it forward within our communities. And as many of the colleagues here on the panel are trusted members of the community, we need to be able to be sure that we have our information correct and not fill in information in the absence of facts. So for example, if we don't know, it's okay not to know, because we cannot say something that is not based on science, in a way that's so matter of fact. That is doing an injustice to our communities who have already experienced situations such as Tuskegee, such as the sterilization of women in Puerto Rico, such as the Guatemalans in the country of Guatemala who are also part of the Tuskegee experiment, and who in 2010, President Obama apologized to the Guatemalan government. So that within the Latino community, this information is there. And so and let's not, if we're going to go talk about that, let's talk about what happened in the ICE detention centers to women as well. These are all government attached, and we need to be very careful in our messaging, and also very careful in the information that when we are blessed with being trusted by our communities, share information with them in a way that is culturally and linguistically relevant. And so one of the things that we've been doing here, I'm currently in New York City. I'm very, very blessed to be part of in a very small way, because, many hands make the lift lighter with the Javits Center. And so what we've been focusing on is a lot of information regarding linguistic access to our communities, for our deaf and hard of hearing communities, for people with challenges, whether they be an awareness of them or hidden. And so we really need to think about how those individuals are going to be coming to our doors, because getting to our doors is a question that our communities of color have had. And I think it's a wonderful, wonderful message that Carolyn has shared her experience, and that many of us may be able to share the information that we have in a way that will resonate with our communities.
I think a point that you're making, Wilma, that strategic messaging is so important. It has to be targeted to specific communities, because what I want to hear and what people that I'm talking to want to hear is different than the general public. And I'm going to tell you one thing I did tell folks. When I went to get my vaccine, I saw one other person of color in the whole place. So for people who are thinking that it's who are hearkening back to the Tuskegee experiment, white people are getting this, and they're breaking the door down to get in and get it. So just have to be as basic as that. I saw one other person, and I was there for about 30 minutes. I got my vaccine. I sat and waited the 15 minutes. And in that whole time, I saw one other person that looked like me. So I shared that as well. And I think there's also age difference in the hesitancy rates as well. I walk with a group of women in the morning. Today there was 5 of us. We walk every morning. 3 of us are 55 or older. Those are the 3 who said we're getting the vaccine. The other 2 pulled back when I started talking about it. They got slower. Their pace got slower because they didn't even want to get in the conversation. And I understood that. Well, I don't even get a flu shot. Well, I said, you know what? My reaction to this shot was similar to the normal flu shot that I've been getting for the last 25 years. Well, I don't even get a flu shot. It's only going to make it worse. I'm not doing it. And I don't want my kids to get it. And so I had to change my tone and just ask, studies have shown that recently that 85% of the people will trust their doctor. if the doctor, their physician, their personal physician tells them that you should get this. But that's a barrier in our community because so many people don't have a personal doctor. They rely on the emergency room as their doctor. Now they're not even going to the emergency room for fear of catching COVID. So all of these barriers that we come up against have to be addressed as we put a positive message out there to educate our communities on why they should consider taking the vaccine. Not that you better take it, you should consider, because you can't push this down people's throats. That's another thing that will turn them in the opposite direction.
Well, so for the folks on the panel who do work at either large educational institutions or, in the case of Angela, Albany Med, which is of course the dominant healthcare provider in the capital region, what can those large institutions do? Lina, you work at a large hospital as well. What can they do in terms of outreach and messaging to these communities where there is this trust gap?
Well, I think just piggybacking on what Wilma and Carolyn had said, that our approaches have to be culturally specific. And so for a very long time, the approaches and the practices and the policies which we use haven't been used or developed with minoritized communities in mind. And so an important piece is that our policies and practices have to be developed and implemented with minoritized communities in mind. And so what that may mean is that maybe that information doesn't come from the primary doc. Maybe it comes from the pharmacy. Maybe that information comes from the person in the barbershop. Maybe that comes from an individual in the clergy. But we certainly have to recognize and interrogate how our practices create a further barrier. I mean, one of the things we know a lot of things about vaccine hesitancy, but one of the things that we know is that it's a combination of vaccine literacy, right? So how much you know about what messenger RNA is, vaccine efficacy knowledge, so how much you know about how effective it is, and healthcare trust. So policies and practices around increasing acceptance of the vaccine have to take all of those factors in mind. We have to provide education on the vaccine itself, on knowledge, but then we have to reconcile ourselves with the healthcare trust piece. And so our communities not only know this historical backdrop, as we've talked about, but in their everyday experiences in waiting rooms, I've experienced medical mistrust. And so what we do in times of abundance can inform what happens during times of famine. We are in times of famine, and we're reconciling this healthcare mistrust in the past that is fueling now this vaccine hesitancy now. We really have to reconcile and have some truth telling around how healthcare can engender trust in communities in ways that are culturally informed. And it may look different because many of our policies and practices aren't always culturally informed.
Casey, one of the things I read recently was that what these large institutions can do is utilize businesses, minority businesses in their particular communities to either distribute vaccines, deliver the vaccine, and call back medical health care workers who are actually administering the vaccine. You got to be seen in the room, actually being an active part of the process. And this was, I think, something that Dr. Smith, the woman who is heading up President Biden's advisory board on the vaccine, this is something that she has said. And I think that's important. I have to be seen on both sides of the operation.
Well, what would, I guess that's to pick up Angela's point. If anyone who is in the audience listening to this has a business in the South End or in any other community or neighborhood that is a high proportion of color, what can they do in terms of putting out the word? In other words, how can they be part of spreading the message that the vaccines are safe, that they're effective?
So one thing that,
Well, Stacy, go ahead.
okay. One thing, I'm a member with Carolyn of the South End Community Collaborative, which is an organization, a collaborative of different organizations working in the South End and leaders and community members. And one of the things we've been doing a survey to try to gauge public, it started out in the South End, and now we're looking with the help of Angela to expand it out to 8 counties. But we're looking at trying to gather, see what people's feelings and opinions are about the vaccine, also where they get their information from, and who their trusted messengers are, et cetera, where they'd like to get the vaccine, where they feel most comfortable. But as part of the discussion this morning, the next step, this is to inform the messaging, right? And so the next step that we're starting to look at and think about is how to get that message out there and in what form to get that out there. And because we have creative people and it's a dynamic organization, and it's nothing to a big institutions, but it's not a big institution. It's not, government, which can move slower. No offense to anyone, but that one of the ideas that came up was to do like a social media influencer campaign that hopefully some of the bigger institutions can help fund down the road. But with that, to get people in the community, specific, this could be specific to the South End or start with the South End, but it could branch out to other communities of color in the Capital District. But to have these influencers, to have someone like Carolyn, when she goes to get her next shot, take a video of herself getting the next shot and saying it was, it's not that bad, or here's a few minutes later, here's how I feel an hour later, here's why I did this, etc. So in the same point of businesses, local businesses, or people who are interested in helping get the message out, being part of this social media campaign could be a great way to do that.
Well, with that in mind, let's now let's turn to kind of talking about the vaccines, and we have the Pfizer and the Moderna vaccine that are now rolling out. So I guess if any, especially any of the physicians on the panel were giving, as it were, the elevator pitch to anyone of any ethnicity who had concerns about it, what would it consist of? What would you say about its efficacy, about the side effects, about any any potential risks involved in it, and also just simply how it operates within your body? Does it operate like the normal flu vaccine? My understanding is that it's slightly more complex than that.
I think one of the first things you want to figure out is what the person's concern is. And one of the top things that people are concerned about is, will this work for me? Was it tested on people that are my color? And both of the Moderna and Pfizer trials actually tried to match their demographics of their trial populations with the demographics of the US. And they both were pretty successful for that. Pfizer had 40,000 participants in the US, and 10% of them were Black, and Moderna also 10% Black. If you look worldwide for Pfizer, they had about 25% Hispanic, less in just the US because Brazil was in their trial. And then Moderna, 20% Hispanic as well. And then similar proportions of Asian and Native Americans as to the US populations. So I think that is an important point to make, as well as the fact that they had basically all ages of adults, at least a quarter were seniors. Pfizer actually has 16 and up. So, and then you also want to know, like, did these people have the medical problems I have? Like, has it been tested on someone with cardiac disease, obesity, asthma? And fortunately, a lot of these diseases were included in the trial. There were a few that were excluded that are important to know, and I think we can kind of get into those too. People with stable HIV were included. if someone was immunosuppressed, so transplant recipients, on immunosuppressive drugs, chronic steroids, what else? There's a couple different conditions, but those actually were not included in the trial. And that's important to know. If you actually look at the guidelines, the CDC does recommend that these populations can get the vaccine, but with the caveat that we don't know how strong their immune response will be. And lots of different kind of conditions to talk about. And then, I don't know, the next thing, the most common thing I've heard personally when I ask my colleagues why they haven't gotten it or what their concern is like, I think Carolyn said, it's happened so fast. How did this, you know, every other vaccine we've had has been at least 4 years. I think that's the least shortest. Eric's nodding to me here. And one of the big reasons this one was able to be expedited is because financial. So typically these trials have to do animal and then human safety trials. And then they go phase 1, phase 2, phase 3, and each of these costs more and more and more. But because of all the funding that was poured into this, the businesses were able to take a bit more of a financial risk. And they were able to actually overlap some of the trials. So that helped a good deal to expedite or accelerate this timeline. The other thing that they kind of got lucky with is they didn't see a lot of safety issues. And so the trials weren't paused. They were able to kind of continue. And a third thing that kind of helped these accelerate was actually that as the phase 3 trials are ramping up, COVID was ramping up again. And you need people to get infected to see if these vaccines work. And that just kind of timed out a little bit too. And then I think Carolyn had mentioned as well, we weren't starting from scratch. We've been looking at mRNA vaccines for cancer vaccine development for 10 to 15 years of strong research is behind that. And we've had people looking at SARS and MERS vaccines, and those are kind of cousins. They're all in the same novel coronavirus family. And so that's kind of been behind us as well.
Eric, what would you add to that, if anything?
I think Lina did a great job of explaining that the important aspect is these vaccines went through clinical trials. So it's a rigorous process. I know it seems rapid, but it doesn't mean that corners were cut. So it was a bit of fortuitousness in terms of having a population study. Volunteers came up very dramatically. There's often waiting periods to get this set number of individuals to enroll in these studies. And as Lina mentioned, they wanted to make sure they had good demographics for those studies. They were able to get that rather quickly. The other benefit is that coronaviruses, even though the SARS-CoV-2 virus is novel, the coronaviruses themselves have been studied for over 50 plus years. So we had an idea of the biology of these viruses, how they're transmitted from person to person. And importantly too, once the virus is identified, the blueprint of that virus, the messenger RNA that we use for the vaccine, was identified within a period of a couple of weeks after the outbreak in Wuhan. So it's really yes, it is a fast pace, but a lot of it is due to hard work, fortuitousness, and just scientific knowledge that we have that have gotten us to this point. And additionally too, the groups making these vaccines have been very transparent. They've been very aware that yes, the timeline has been expedited, and they certainly want people to feel comfortable and confident in getting the vaccine. So there's been a tremendous amount of transparency and being able to look through their study plans and their data. They've been pretty good. Initially, there was some kind of press releases came out before the scientific study. So that, again, as we've talked in this panel, like you want to wait for the actual hard scientific data to show that the efficacy is there. Is your population, am I a part of that group that's been studied? And that's all available. So it's really the safety and efficacy were hard and looked at. And right now it's been rolled out and they're still collecting data. So it's not like it's just the end all be all and the group's just like wipe their hands and it's done. There's still data being collected. There's still questions that of course we're still trying to gather. Like Wilma said, there are a lot of, we just don't know. So how long is the vaccine gonna work? It's still, we have to figure out and just wait and collect the data.
Lina, can I just ask the question? Someone just actually texted me and asked me, did Lina say that people with asthma were or were not included in the trials?
Were, as long as it was stable, not requiring hospitalization in the previous weeks. I think it was 6 weeks.
Okay, thank you.
And I would just pause here to say, if anybody who is in the audience and listening has a question, you do not need to text Carolyn, although it's not a bad idea, but you can just put your question in the chat. We are monitoring those, and we've set aside time closer to the end of the program that we'll try and take a couple of your questions.
They were on YouTube and they couldn't, there was no way to ask a question or something.
Oh yeah, usually you should be able to put it in down below. Don't worry, we're watching those. So
okay, all right.
Now,
go ahead. I'm sorry.
oh, I was just going to say. So in terms of side effects, I got my flu shot. My arm was sore for 3 days. Is there anything similar with either the Pfizer or the Moderna vaccines?
Yes, there are definitely adverse effects. I've had both, so I can speak to both. But in terms of what they saw in the study, the most common for the local is kind of a sore arm, basically. And actually, depending on who you're looking at, the demographics, which study it was, the age group, it was up to 80%, maybe even 89% that would get a sore arm. So I would almost say go in there expecting to get a sore arm. But the good news is these are all kind of short-term side effects. Now, there are also systemic side effects, and a decent number of people get these, maybe around half, more common with the second dose. And that the two most common are fatigue and headache, but people are also getting body aches, chills, less fever. I personally had a very sore arm, couldn't sleep on it after the first one. And then the second one, again, a sore arm, maybe about 6 hours in, and then 12 hours in, I was under 5 blankets, shaking and shivering. That probably lasted a few hours. When I woke up, I took some Tylenol, and I was able to work the next day. I didn't have to, fortunately, but I think I could have. But just, they are short term, but don't be surprised if they happened. It does not mean you were given COVID. We can kind of jump into that, I think, too, if that's a good spot to segue, Casey.
Yeah, no, absolutely. So to be clear, when you get the shot, you are not being given COVID, correct?
That is right. You are getting something called messenger RNA. Casey, this is probably more Casey's department, but I'll say a little bit, and I'm sure he's going to give us a lot more detail. Something called messenger mRNA, that is a very small molecule, and it codes for the spike protein of the novel coronavirus. And it does not stay around long in your body. It's degraded very quickly. We naturally use mRNA all the time just to create proteins. And so you can imagine if these built up, we'd have no room for anything else in our cells. So they're degraded very quickly. Casey, I'll let you give a little more kind of microbiological.
Oh, no, Eric, not me. I'm not going to be any help at all when it comes to messenger RNA.
I was going to let you run it, Casey, and see what it does.
No.
No, I think you, Lina. I think you gave a good talk. I should have you come and give a lecture in one of my classes. But it's so first off, the side effects. It's kind of unfortunate to call them side effects because really it's what you want to happen because it means your body's responding. The purpose of the vaccine is to educate your body to the pathogen without getting the disease. So all those effects that you experience, and I had my first dose a week ago and my arm was pretty sore. I couldn't sleep on it. And I've heard about the secondary effects after the second shot, but it's your body's response to the vaccine. Your immune system is being turned on, and you want that to happen because that means it's responding. In terms of the biology behind it, as Lina said, our bodies are making messenger RNA all the time. So our body has the machinery, and this vaccine is just supplying, if you want, basically instructions, like an instruction manual, put into your body, telling your cells to make this viral protein, and it educates your immune system to respond against that. So it's before any chance you've been exposed to the virus. And importantly, it's no viral proteins, there's no virus at all. You can't get sick from this. Some of the symptoms might overlap, and it's been something that's been in terms of being communicated to individuals is to make them aware that the symptoms might seem like COVID, but it's really part of the vaccine. And it's important to mention that and not to scare people away from getting that second dose, because we also know that you need 2 doses of this vaccine. There's been some talk about, can we have the dose or can we give just people a single dose? And that wasn't part of that clinical trial that Lina mentioned. It's very specific guardrails for how these vaccines should be delivered. So although there is this urgency to maybe kind of switch things up, really it has to be the 2 doses at that amount that was in those studies. So also encouraging people to, don't be afraid of those secondary effects that they may occur, they may not occur. As Lina said, about 50% of people have this effect. But once you're vaccinated with those 2 doses, we know that the efficacy is quite high. And again, we're trying to see as time goes on how long the efficacy is. Moderna seems to think it's at least a year, which would be great. Different, in case you mentioned the flu vaccine. So just to kind of clarify that. So there's a variety of different vaccines out there. Flu comes in either a weakened form or a killed virus form. And although there's vaccines for COVID-19 that are being studied using those particular platforms, they're not yet available. The ones that might come up are a viral vector vaccine, and those are the ones that might come up next. So the other thing to keep in mind is that the landscape, kind of the whole thing with this COVID-19 pandemic, is things are constantly changing and chaotic at times, but there'll be likely additional vaccines out there. So it's not going to be like there's just one vaccine type. So I think the education part is going to be continually evolving as these new vaccines come out, making sure people understand what the new vaccine is, that they have to get the same vaccine for that second dose. They're not interchangeable. And with that comes some logistical challenges, to be sure.
We do know, and a couple of people are noting on the chat that these vaccines have both received FDA approval. There have, of course, been concerns raised about the process by which previous therapeutics for COVID-19 were approved, that there may have been political pressure brought to bear, but the process for approval of the vaccine, no one has called that into question, at least as far as I've heard.
Correct. And I think it should be clear, it's not really an FDA approval. They've been given an emergency use authorization, which is slightly different. And that's more because of the pandemic. So there's certain kind of benchmarks for EUA versus a full FDA approval. Now, it doesn't mean that this is, again, a weakened form of how a weakened format for how the vaccines were tested. They were still gone through a rigorous process. There's just a little bit of difference in how the formality towards the end. And additionally, as Carolyn mentioned, and there's some concern about, well, the government's involved. So the other important part is towards the tail end, after the studies were completed, the data was handed over to people that are not government paid for. They are independent scientists, health professionals, other individuals with vaccine information and knowledge. So they looked at it unbiased, and they made the call to say that it looks like a good study. The safety data is good. The efficacy data is good. They recommended it for EUA approval. So there is, granted, it is unfortunate that there is a charged environment, and the vaccine hesitancy kind of dovetails a little bit with the hesitancy for using other non-pharmaceutical interventions like distancing and mask wearing. But really, the vaccines were looked at by an independent group, and then their recommendations were passed on to the CDC and FDA.
And in addition, in New York, the vaccines, or at least the process by which they received the FDA's, and I'm sorry, give me the term again, emergency use authorization, correct?
Yep. EUA, correct.
Yeah, that has been looked at as well by a task force that the state pulled together as well.
Yeah, that was independent. And I think it's also important to note that the National Medical Association, which is a group that represents Black physicians, made a pledge to review any drugs or treatments that were given an EUA during this pandemic, and they have unanimously approved the EUA from the FDA's for both the Pfizer and Moderna vaccine, and they had another independent group look at them.
And actually, if I could speak on that point, the president of NMA is going to come and speak to us here at Albany Medical Center in February on this topic of vaccine hesitancy.
So with that, if perhaps we could pull back a little bit. Concerns whether based on sound scientific fact, or based on disinformation that turns up on the internet, is of course not simply a problem that arises within communities of color. I myself have covered numerous anti-vaxxer protests down at the Capitol. Those crowds are primarily exceedingly Caucasian in nature. but if we could talk a little bit about what vaccine hesitancy means and how it exacerbates a wider range of health disparities that affect communities of color, not only in the capital region, but across the state and across the country. And I guess for that, Wilma, I might turn to you to kind of start off. Oh, you're on mute.
I was just thinking about, the comment that was made about, anti-vaxxers that are primarily Caucasian, and, there's a lot of protesting. When communities of color protest, it's a different story. And so, it's not sometimes taken in that same light. And so I just want to make sure that cultural lens is included in that as well. And then regarding your question, if you could repeat the question, please. I focused on that one piece. To what extent there are vaccine concerns that reach across racial groups, but within communities of color, there is the additional danger that they will exacerbate, health disparities that are already prompted by not only concern and paranoia about government health, but economic inequality and pre-existing racial inequality as well. Yeah, and that's been the case. As was mentioned by a fellow panelist. You don't have, many of our communities don't have that relationship with the physician that grows over time to talk about different vaccines and immunizations and how that happens. Because sometimes you don't get the same physician for, regarding pediatrics, who's going to give your child the MMR versus, who's going to continue to give any vaccination may not be the same physician, because you may be going to a clinic where that may not be the situation. And so how can you even build a relationship to ask about any questions about a vaccine? So there's the disparity there. A lot of what has happened within our communities regarding accessing these services and building those relationships has been brought to the forefront during this pandemic. And so how do we move forward with that? And I completely appreciate those who are trying to learn and to understand what our communities have been experiencing. However, this is not the time to read a book or see a movie, because while people are learning, our communities are dying. And so how can we continue to move this message across so that there is that opportunity to have some kind of continuity in care, and that continuity in care is the individual's choice, not the circumstance in which they are put. Those are two separate conversations. And so, yes, it does exacerbate. So if, we are going to get to the point where the individual is going to receive the vaccine, because we have been, there's information on the DOH website about, the safety of this and all kinds of information, just as our colleagues may have information on their organizations, platforms as well. So how do we ensure that a person who gets their, vaccine at one point is going to trust us to come back to do the second piece? I mean, again, it comes back to trust and this situation of the continuity of care, which really now has become a really critical piece in receiving a vaccine that is safe, that is effective, and that is equitable.
I think also, I like that Wilma has used this continuity of care. I've spoken to individuals, they go to the doctor, they see the doctor, and then the ensuing visits is the nurse practitioner. No disrespect to a nurse practitioner, but if you are used to seeing the doctor and you really don't understand what a nurse practitioner is, all you hear is nurse, and you don't understand that they've gone to school for probably 7 years to become a nurse practitioner. But the fact that you have to insist on seeing the doctor, and in some cases where I've spoken to individuals, their care changed completely when they got back to the doctor who they had more confidence in. So I believe you have to give the individual the respect of seeing the doctor who they may know and not know that nurse practitioner. I mean, because I have an example of, and I have reason to be one of those people who continues to question when I go into the doctor's office. One of my family members passed away. She was sick for 1 week. She had seen her doctor, but the day before she died, she saw a nurse practitioner who sent, this was 3 weeks ago, who sent her home with a breathing problem. And she passed away the next day. So it's these kinds of, and I'm not an anomaly. These kinds of things are happening. Maybe the fact that she passed away so quickly, that is not unusual. But other individuals are concerned about being sent home, particularly in the age of the pandemic, being sent home to take care of themselves almost. And so I believe that that is one of the issues that has to be addressed as we continue down this track of, if we're ever going to reach herd immunity or community immunity, these are things that have to be dealt with, not as an afterthought, but as we progress in dealing with the pandemic.
Right, right. You know, this is an opportunity for healthcare to really evaluate the unequal treatment of communities of color at the end of the day. Because, you know, even if every non-minoritized person got immunized, we would only be at 60%, and we need about 7 to 80% for herd immunity. So what it sounds like as a person of color is that now we have to step up, but that doesn't sit right because of the everyday types of experiences in healthcare. And so this really is a moment of reconciliation where there are some ugly truths that I think have to be talked about and repaired. And it may not get repaired in the time of COVID, but we have to start that conversation now.
Here's a question that somebody asked for Lina. Did Lina receive both vaccines, Pfizer and Moderna, or both doses of one vaccine?
Both doses of Pfizer.
I received 1 dose of Pfizer. I get my 2nd dose next week. I see patients, and so it was very important to me to get vaccinated. I didn't have any necessary side effects. I didn't have a sore arm, which is sort of interesting. With my flu shot, I certainly did, but not with this. It's kind of interesting. I think I'm a bit of an anomaly in that regard.
I had the Moderna, my first shot, and I'm scheduled next week for my 2nd. And like I said earlier, we had similar effects. I had a sore arm for about 3 days. And that's the same thing that occurs when I took my flu shot in October. So
I guess that's something we haven't touched on. Just the logistics of this is that that it's 20 to 24 days, I think, depending upon which.
Yeah, it depends on the vaccine. Yeah.
21 and 28.
Yeah,
21.
Pfizer's 21 days in between the two, and Moderna's 28.
Mm-hmm. And it is absolutely not optional for you to go back to get the 2nd dose. You absolutely have to do it, correct?
You want to get the same one. I mean, they haven't studied doing one and then the other. You know, the studies have been of Pfizer and Pfizer or Moderna and Moderna.
Yeah, you don't.
And when I got the first one, they scheduled you right there for the next one. It wasn't like you had to call back and schedule. They gave you your little appointment card and made your appointment before you left for when you come back for the next one.
But I have a question then. If so with that, so recently in the news that they've announced that they're not holding back on that 2nd dose anymore, and they're going to vaccinate as many people as possible. So is there the possibility that the vaccine's not going to be there for a portion of the population's second dose.
When I heard
Everybody
that
knows
today, Stacy, I
Let's
was
see.
concerned about that too. I was concerned. I said, is my second dose still in the freezer? That's immediately, you know, what
Bring a
I
cooler with you and then take your dose.
But I thought about that as well. And my concern is that, well, there seems the national rollout has been slow, but considering that they're trying to provide the vaccine for as many people as possible, I'm assuming that it's going to speed up a little bit. But even though we didn't put our order in with Pfizer initially, and other countries, it's been said, you know, got their orders in before we did. So that's why we might not have the same supply as we'd like to have as other countries may have. But hopefully it'll keep moving.
And I don't know if that's a question that anybody on this panel can answer at this point, especially because the sort of federal guidance, I mean, it was just today that the CDC recommended that the vaccine become available to people 65 and older. It, of course, was just within the last, a week or 10 days that people 75 and older became eligible as well. I mean, I hate to put Wilma on the spot, but she is the only one of us who works for state government, so I might have to.
All right, so whether or not I have the scoop or the skinny on this, you know, I quite honestly, I don't want to tell you a story. And again, I'm going to use my own advice and say, I don't know with sufficient authority to say this is what's going to happen. I think this is a situation where we need to continue to look at the Department of Health website so that we can get the most up-to-date information, that we continue to look at the CDC information as well. And then also to understanding that we are going to be under a different federal organization, authority, what have you, pretty soon. And so this is very fluid and to a degree can be changing perhaps faster than any of us can keep up. So if I talk to Lina, Angela, Eric, you know, it could be likening it to a parable of the 7 blind men touching the elephant, you know, different parts of the elephant. Each person is accurate. However, they're looking at it from a different lens and from a different perspective. And so I think that, you know, what I can share is, and trust me, I'm not holding back any information, or anything. I just honestly strongly feel that to continue to look at the DOH website, and then also too, when you have the opportunity to listen to the governor's briefings, you know, transparency and data and science has been the cornerstone of his messaging to New Yorkers. Mm-hmm. So I would continue to look for guidance in that way.
So here's a question: what happens if you don't get the second, the booster? And are we correct in describing it as a booster, the second shot? And so what would the consequence be if you did not get it in time? If, for example, there was some kind of holdup in the distribution chain, and instead of getting it, you know, 21 or 28 days later, you got it 36 or 50 days later?
It's a good question. I think it's important, yes, to get that second dose. And I think as Wilma has highlighted, this is a tall task. Like to have a global, to have a state, national, and global vaccine campaign of this scale is amazing. It hasn't been seen probably since polio and smallpox. So first, people need to have patience, and it's frustrating to say, well, the vaccine's here and I want it tomorrow. And there's only so many doses that go around, and it does seem to change. I'm sure that's frustrating to people. And you say, well, just last week you told me I'm 75, I can get it, now it's 65. So it is a little frustrating, but patience is needed. In terms of the timing, that's a good question. Hopefully there'll be enough doses where people can get their second dose in a timely fashion. You know, it wasn't done in the study, just based on my knowledge of the immune system. You know, a little bit of wiggle room is probably fine. I wouldn't wait half a year necessarily, but really it is, as you mentioned, Casey, a booster. So it's meant to basically increase your ability of your body to respond to the virus. So there is likely some level of protection, and Carolyn's story highlights that. There's some level likely of protection after a first dose, but certainly there's no number, there's no hard science attached to that, like the second dose with the phase 3 trial. And I think what we want to do as a vaccine's purpose is we're giving something to healthy people, and we don't want to cause disease and we don't want to cause confusion. We certainly know that getting COVID has long-term impacts and closer impacts. With this vaccine, we want to give it to people with certainty. We don't want to vaccinate a large number of people and say, well, we think you're vaccinated, we think you're protected. We want to be able to say that we've given you the vaccine, 2 doses, you're protected.
But it's fair to say that your protection doesn't go down to 0 if you get the first shot and then for some reason your booster shot is delayed. It doesn't mean that you are now completely naked and vulnerable to COVID infection.
Correct. You're not resetting to 0. So there is going to be some level of protection, similar to if you were exposed to COVID naturally. You have some level of immunity, and immunity persists for an indeterminate amount of time. That's still being studied.
So here's a question, and I don't know if anybody on the panel will be able to answer this. Why are the pharmaceutical companies that have developed the vaccines granted immunity from any liability? I think for people who do have fears about the vaccine, that might be a political or an economic question. I don't know if anybody wants to take that one on.
Yeah, I haven't heard about that, so I can't comment on that.
Yeah. Okay. Do we have any other questions at this point? And while we wait for those, I guess I would just throw it out to the panel. Is there any aspect of this phenomenon, of this challenge to all of us that we haven't touched upon that you'd like to bring up? Does anybody have any final thoughts or any calls out to the community, not necessarily communities of color, but communities across the state?
Well, I would just like to say to those who are going to be administering the vaccine and in charge of rolling out the vaccine to the various communities, to just work to eliminate any barriers to people having access to the vaccine. I know right now we don't have the vaccine in our community at the level at which we'd like. But once it is here, make sure that it's in the community, that people don't have to take a bus to SUNY to get the vaccine. I should be able to go around the corner to maybe my Walgreens or maybe my CVS, or maybe even the housing authority. You have people who are sitting right there. Why not look at using their community room as a place where you can provide access to the vaccine? Eliminate barriers so that people are more likely to go and get the vaccine. So that's just some word of admonition I would give to the Department of Health, to Albany Med, and anyone else who is in charge of dispersing the vaccine in the community.
I'd like to thank you all for taking part. Once again, Associate Commissioner from the Department of Health, Wilma Alvarado-Little, Carolyn McLaughlin, Albany County Legislator, Lina Finlan, Stacy Pettigrew, Eric Yeager, Angela Antonikowski. We very much appreciate the information and the perspective that you provide on this very serious subject. So thanks so much again for taking part. Thanks everyone who's listened into this discussion, which will live on timesunion.com as well as our Facebook and YouTube pages. We really appreciate your taking the time, and I hope that everybody stays safe and stay informed as always. Thanks very much.
Thank you. Thank you for having us.
Thank you.
Yes, thank you. Thank you.
Thank you so